So I'm Chris MacLeod. I'm a fellow of the Association for Project Management. I've been working on within the project environment for probably 10 or 15 years now. So this year's obviously brought about some considerable change, and that it really manifests itself in the teams not being co-located in a physical environment. And I think that actually has a really big bearing on well-being and mental health. For me personally, I've enjoyed the fact that I don't have to commute into work anymore. I had a long commute, so working at home has been a real positive thing. The pandemic is touching people in different ways, and we can't always be aware of what's going on in everyone's personal lives. And this is a particularly horrible virus, and it's having particularly horrible effects on individuals, let alone the pressure they might be feeling at work. I think people will need to balance how they take the relevant approach in relation to that, and really make sure it works for their organisation, but taking real account of what they need as an individual and making sure they get the support that they need and they're not feeling isolated. One of the challenges as a project manager is that you are someone who likely already has a good deal of resilience, because as a project manager, you will front up a piece of significant work. You'll be the person who many of the stakeholders will turn to if things go right as well as if things go wrong. And so now, working remotely for a lot of us, that relationship will probably be slightly different. Without those chance encounters with those stakeholders, those key stakeholders, you are having to do things more proactively to get those calls in with people and probably provide them a bit of expectation management. Being a project manager is a pressurised role, and I can imagine working from home can be positive in some regards and also add pressure in other regards. The inability to see people on the regular basis. So in the office, you'd bump into your colleagues, your teammates, and you'd be able to ask them, how are you doing? And to see their response as well as hear it. And you'd see that through their body language, and you'd probably get a sense as to really how they're doing. Are they okay? Or do they just need a bit more of a, are you really okay type discussion? Now, talking on whatever media you might be using for collaboration digitally, that can be much more difficult because some people won't necessarily use their video. Even when they are using their video, it's perhaps not as personal when you're in a wider group setting. I often think about mental health as being very similar to physical health. So we don't have to be experts to help each other with physical health. We don't have to understand the ailments to provide support. Mental health should be treated very similarly, which is someone has a mental ill health condition. We're each entitled to try and help provide them with support, something which I think we can all do within working environments, project management environments included. I don't have to understand the whys and the wherefores and how they got there. I just need to know that they're reaching out for some support. They want to be understood, but to be able to share their experience and how they're feeling. And sometimes it's around just demonstrating you're able to listen and demonstrate empathy to really support your colleagues. Just being aware, perhaps more aware than we were back in the office, because I also think it's easier for people to tap you on the shoulder in the office to say, can I have a quick chat? So for me, I've certainly tried hard to make myself more available to team members to say, if you do need to have a chat, let me know, I'll make some time. It's made a difference to the way that I engage with my team. So even this morning, we've had a call which is a non-work call, things that people are doing in their lives, things that people are interested in, things that make us laugh. In fact, I find that a really important part of my working day, being able to have a chewing the cud type discussion rather than just task-based all the time, and really putting the focus on well-being as something that we need to be keeping front and foremost in our minds, and also enabling people to feel that this is actually something we care about, and making it a very real topic that they can share information about or ask questions about and feel confident in talking to each other about too. It's a lot about listening, a lot about providing reassurance and trying to flex the approaches you're using, I think, as you go. And we probably would have done that before the pandemic, but in a slightly different way.